Okay, let's see. Here we are starting with the veins. We're just going to make a simple diagram of the veins, and we're going to start our story at the heart, which is always a good place to start. And remember that veins are going to be connected to atria because atria receive blood. And so this right here, this is called the right atrium. So that is where the blood from the body is going to empty into. All of the blood from draining from above the heart is going to go into the superior vena cava, and the blood from below the heart will come from the inferior vena cava, which kind of goes all the way down into the abdomen. Okay, so this one right here is the superior vena cava, and you don't need to write, you don't need to write vein because vena means vein already. And then this one right here is the inferior vena cava here. And the inferior vena cava is going to go through the diaphragm and then go down into the abdominal pelvic region there. And then on the other side, it's also still called inferior vena cava. Same thing above the diaphragm as well as below it. Okay, so it does not change its name, it's still the same thing there. So let's start with branches of the superior vena cava first. The superior vena cava is going to split. And one thing that I'd like to point off right away is that for the veins coming off of, or kind of draining into actually the superior vena cava, it's going to be very symmetrical. So we have both the right and the left are going to be the same. So you don't need to designate right or left because they are the same. So this branch and this branch both have the same name, and so this one is going to be the Brachiocephalic Vein. Okay, Brachiocephalic Vein. Brachio because it's going to continue on into the arm, and cephalic because it goes up into the head. Okay, so the Brachiocephalic Artery is going to have some branches. Two of the branches are going to go up to the head. The bigger branch is going to be called the internal jugular vein. So that's the big one. The big one going to the head is the internal jugular vein, and the small one going to the head, it's often hard to see, sometimes not shown well on models. The small one is the external jugular vein. Both of them are going to go upwards towards, or I guess I keep saying going upwards, but they actually drain from and go back to the heart, because veins bring blood to the heart. It's always hard for me to remember that. Okay, so after those ones go up, this part right here then, this is now called the subclavian vein. And again, you don't need to designate left or right because everything that happened on this side is also going to happen on this side over here. Same thing on that side. They're symmetrical for veins, not for arteries though, so make sure you're careful with that. Okay, so the subclavian vein will pass through, and at the point where the lateral margin of the first rib, which just means the outer edge of the very first rib, it becomes something different. And then once it's in that region, now it's called the axillary vein. And the axillary means armpit. So now we're going to be in the armpit region there. At this point, the axillary is going to continue on and become something different. That is now going to be the brachial. Okay, the brachial vein. But before it does that, for veins, there's going to be another big branch kind of going upwards. So there's actually three major veins for running through the arm. The one that's up on the top region, that's going to be called the cephalic vein. Cephalic is kind of above and top of. and then so that's branching off of the axillary vein, and then in this region here, coming off of the brachial vein on the kind of medial lower part of the arm, then you have the basilic vein. Okay, so the brachial vein will be the deep one running in the middle. The cephalic one will be the superficial one running kind of towards the shoulder area along the top. And the basilic, like base, is going to be the one running along the bottom. Okay, so they're going to continue on. Basilic and the cephalic will continue, and so will the brachial. And then what happens at the elbow, kind of around in the elbow pit, the basilic and the cephalic sort of connect with each other. And this little diagonal connection here, this is called the median cubital vein. Okay, so the median cubital vein, cubital as in elbow pit. But notice that it does not connect to the brachial. It's just that the brachial vein is deep to the median cubital vein. The median cubital vein is superficial, and that's why you can see it, that vein running in your elbow pit right there. Okay, so the brachial vein, which is the deeper one running through there, once it gets down to the forearm, it's going to split off, and then the medial one will be the ulnar vein, and then the lateral one will be the radial vein. Okay, and all of that's happening in your arms. Okay, so now let's go and talk about branches of the inferior vena cava. Remember that it's called the inferior vena cava that whole way along, the whole distance across. The very first branches, major branches of the inferior vena cava, those are going to be called the hepatic veins, and there's a little couple of them. And so they're going to go to the liver. Okay, so here we have the hepatic veins, and they're going to go to the liver, or actually drain from the liver. I'll keep messing that up. And then draining from the kidneys on either side. I draw them as if they're kind of connected to each other, but usually you have one kidney above another kidney. So you have the renal. Okay, so there's your kidneys, kidney. So the blue ones, blue equals veins. The only exception would be the pulmonary veins. Other than that, the veins are always blue, so if you see a blue on a diagram, it's going to be a vein, and the red will be arteries. So the blue one that's going from the kidney, this is going to be the renal vein, coming in and emptying into the inferior vena cava. Okay, continuing on down, we're going to have the gonadal veins, because there's no mesenteric veins at all. No mesenteric veins, just skip right over those. Now, on to the gonadal veins. These are the only one of the veins that I'm having you learn that are not symmetrical with each other. So if they are not symmetrical, that means you have to designate right or left. The left gonadal vein is going to come off of the renal vein. So here is the left renal vein. The left gonadal vein is going to come off of the renal vein. Okay, whereas the right gonadal vein is coming or going into directly from the inferior vena cava. So you have to designate right or left because they are not symmetrical with each other. Okay, so here's the left gonadal vein, and here is the right gonadal vein dumping into the inferior vena cava, which brings it back to the heart. Okay, from there, the inferior vena cava is going to split. Okay, so please note that the shape of the split is the same shape as we saw with the arteries already, so they're going to kind of follow each other. So again, here is the inferior vena cava, still hasn't changed. it'll split off into the two common iliac veins. Okay, so two of them, one on each side. And whenever you see common, common means that it's going to split again. So we have one going in, and then it'll continue on. The one that it goes in is called the internal iliac vein, and the one that continues on a little bit is the external iliac vein, and then that'll continue on until it reaches the edge of the abdominal cavity. So here we have like the body wall, and on the other side of the body wall it'll sort of pop out in what's called the femoral triangle, which is the just outside of the body wall, kind of sandwiched between the muscles, so very superficial. That will become the femoral artery. So the external iliac artery, after it exits the body wall, it's going to become the femoral artery. Sorry, not artery, vein, femoral vein. Okay. And then the other one that is not present in the arteries that we talked about is the great saphenous vein, and that'll come on the back of the leg. Okay, so it kind of follows along sorry, I should say medial, on the medial aspect of the leg right here. This is going to be the great saphenous vein. Great saphenous vein. Okay, that is all of the veins that we need to know, I think.